Hey beautiful people, it is another awesome episode of Medshield Movement Connect show with me, Dr. Fez. Now it's International Children's Day, which means we're going to connect some dots for you when it comes to children with Dr. Gcaba, a lover of kids, also known as Dr. Mommy. Can't wait. Get ready to know what you don't know about being body brilliant. This is the Medshield Movement Connect show, where we connect the dots between fitness, health, wellness, nutrition, and of course you. Hosted by me, Dr. Thabile Gcaba, and a special guest that we have every month, sharing knowledge, insights, and groundbreaking tips on how to get fitter, be stronger, and live healthier. Turn up the volume and listen close. Today you amplify. It's the Medshield Movement Connect show. Let's go. Thank you so much for sitting down with us, Dr. Gcaba.
Thank you. It's a pleasure. Thank you for inviting me, Fazile.
Well, is it Dr. Gcaba or Dr. Mommy? Because I know you go with both, right?
Yes, I go with both. It was a friend of mine who actually gave me the name Dr. Mommy because she says I'm a mom to their kids because they come to me with all the questions. So she just said, forget Dr. Gcaba, you are Dr. Mom. And that's so I went with that.
You see, that's so endearing because it
Yeah.
does. It makes people feel at ease. And I know you've had so many years of experience working with kids. Could you tell me why it is you decided to become a doctor and why with kids?
Okay. I think when it comes to the decision of becoming a doctor, I'm not sure where it came from, but I know that it's something that I had wanted even before high school. Like I remember I found an essay that I wrote in grade 6 that said, when I grow up, I want to be a doctor. But
Grade 6 already?
yes, my reason was weird. I said because I want to pamper people, but you don't pamper people in the medical space. I think also part of it I was influenced by my mom. My mom is a professional nurse, and she wore that title with dignity, and she loved her job. And even to this day, like she's retired, but she still loves her job. She's still part of the Nurses Guild at church. And I think I fell in love with being in the health space. Yeah. And then about being a pediatrician, when I started doing internship, I knew that I will not be able to survive as a general practitioner because it's a lot.
Yeah, it is.
You need to know everything. And I honestly, I have a lot of respect for general practitioners, but I felt like I wanted to streamline my knowledge and I wanted to just focus on one thing. So as I rotated through all the rotations, you know how internship works, I was taking everything off the list. There's no way I was going to become a physician. It's just hectic. I don't like being in theater. I wasn't going to become an anesthetist. But funny enough, pediatrics was my last block. And I just fell in love with those kids.
Yeah.
And I had a bit of an understanding with the mothers. And I said, no matter what. And I used to watch all the registrars. There's a lot of accountability in pediatrics, you know. No child dies without us having had a discussion about what has happened. And I think I enjoyed that accountability and I never looked back. Yeah.
I love that it is something that can be quite overwhelming because when you're in the field, there's so many things you can do. But I also love that you were able to be like, no, that's not for me. Like you're very distinct and sure of knowing that this thing wasn't for me. But now when you chose that, you wanted to be within the sphere of child and health within children and making them feel better. You were there in the rural and the urban areas.
Yes, I was.
Could you tell me what the difference was in terms of the approach in treating children when it came to that?
Okay, so I've worked, as you've said, in both urban and rural areas. In the urban areas, we are better resourced. There's a lot of support from the senior staff, so you feel protected. Okay. And then when I left and did community service in a rural hospital, I did feel a little bit lost because suddenly I was the one that the nurses were coming to for advice and I had to be the one to jump and start a resus, you know. I had to be the one now to make decisions, you know. The support wasn't within the hospital. You would need to make a phone call to a hospital that's probably another 50 or 100 kilometers away so you can transfer the baby. So it was quite scary from that point of view, and I would always question myself if I'm making the right decision for this child. And when I'm talking about this child, I'm actually talking about the family, because there's this child and then there's a mother and a father, grandparents, you know. This child is of value to someone. So it became a little bit difficult because I was so junior. But at the same time, I think I grew strength. I learned a lot from being in that situation. I also want to say that working in the rural environment, there was so much love within the community of health professionals in that hospital. So it wasn't just me and the doctors, like how you would see in urban areas. So it's the nurse, the physiotherapist, dietitian, everybody works together as a team, and there's that sense of respect, and also the community that you serve, they are so respectful. Yeah,
That's
and
true.
they are so
It's true.
grateful.
It's
They are
true.
so grateful just to have a doctor there, So I learned a lot.
I mean, I think that's the beauty of it. I know when it comes to not having as much in terms of resources,
Yeah.
what you then counter that with is like love and the passion to do the
Yes.
work, which
Yes.
then helps you get the outcomes that you want.
Absolutely.
But speaking of those outcomes, and especially when we speak to urban rural areas, sometimes you don't have access to somebody, or you might not financially be able to see a pediatrician or even a general practitioner. Could you tell everybody at home some of the general milestones that you will find with children as they grow up, what to expect at 3 months or 6 months?
Yeah. So there's a book, the Road to Health booklet. I think every mom or dad or anybody who's looking after a child should read this booklet. So remember, many years ago, when we were born, we had this little page with the green writing that nobody understood what was written there, and our parents thought that it's just for the clinic. They didn't know that there's so much information about the baby, about the length, the head circumference, and the weight. Things have evolved now. So things have evolved. We now then evolved to a Road to Health booklet. There was one for boys and one for girls. Now they have integrated it into one solid booklet. The reason why I'm mentioning this booklet is because it has a whole lot of information. It's got even milestones. So back to your question about milestones, we look at the major milestones, right? Because there's a lot. Children grow every day.
Yeah, definitely.
Children grow every day. They grow by the day. They grow by the hour. So we need to look at the broad milestones. The first important ones that we look at 6 weeks. So your baby at least should have their eyes open most of the time at 6 weeks. They shouldn't be sleeping most of the time. And there should be some interaction. Baby should be smiling, should be looking at you. They should be able to look at your movements, okay? And I'm just talking about the positives. There are also some red flags as well. I'll get into that. And then we go on to jump. I'll jump a lot. I'll go to 6 months. At 6 months, that's when baby should learn how to sit, start learning. I didn't say they must sit at 6 months, so they are starting to learn how to sit. Some babies are a bit more precocious than others, so there's a range. You'll find that a baby might still be the tone might be still very low, so they're not able to straighten their back. They only sit maybe for about 2 seconds and they fall. That's fine, as long as the baby is making an attempt to sit, right? And they should be interested in their hands. They start playing with their hands at that age. They put their hands in the mouth, or they grab an object and they put it in their mouth and they start babbling. So they make noises and they play with the spit, whatever. That's when they put on a bib, right? Then at about 9 months, they should start crawling, at least start crawling at 9 months, or hold on to an object and pull to stand. By 12 months, that's when now you should hear a few words with meaning, maybe 3 words with meaning, mama, dada, and maybe a sibling's name, right? And then by 18 months, they must be running around. They should be running around, and they must at least be walking. If they're not walking by 18 months, that's a problem. So, and then 2 years, more than 50 words with meaning. 3 years, that's when they put 2 to 3 word phrases together. So, mommy, water, please, So it's like broken language or broken English. So those are the broad ones. The red flags, I'll quickly go into that. If your baby is not smiling at 6 weeks, that's a problem. Smiling is social. It's part of the social development. When you're looking at the milestones, we look at the physical development, which is the motor. Fine motor development, we're looking at your coordination, your eye coordination, and your movements with your hands. Speech and language, the sounds that you're making, right? And then we're looking at the social. So social is smiling. Is your baby smiling? Is your baby interactive? At 9 months, your social development is part of your social development for a baby to not be interested in strangers. So stranger anxiety. So a baby that doesn't have stranger anxiety, that's a bit of a problem. Yeah, so it's a lot, I know, but I just wanted to highlight the big milestones and a few red flags.
And I think it's important as well that you talked about the Road to Health booklet, because it gives you a reference point. Because again, these are things that you're looking out for, and some red flags where you go, okay, I need to go see somebody, but you could sit here for hours when you're talking about the developmental components of a child and which part of the brain. But it is always good to get an overview. But speaking of overview, because people do sometimes feel anxious, especially first-time parents, they'll be like, okay, should I go see the pediatrician or the GP all the time? What are potential signs that my child is not growing as well? So what, again, broad stroke concepts around if a child isn't feeding well, what are some of the flags that would be there?
Okay. Again, I'll take you back to the Road to Health booklet.
It's a good one
So
to
at the
go
back
back
of
to.
a booklet, you have danger signs. So when you look at the back of a booklet, it tells you which signs to look out for that are red flags that will make you run to the doctor or the clinic or the hospital. So I think they have a child that's passing. And before I go into depth with that, it's in pictorial format. So even the parents who cannot read, they will see the pictures. So they've got a child that's vomiting everything. They've got a child that's having loose stool, so lots of diarrhea. They've got a child that's shaking, convulsions. A child with a fever. They've got a child with swollen legs. So if your child has swollen legs, those are the red flags. You need to go to the clinic. You can't sleep. You must go to the clinic. So those are general red flags. But I tend to break it up into age groups because it becomes easier. Because if a mom is sitting with a 6-week-old that's not feeding well, that's actually a red flag. That child must feed. If your baby is not feeding for any reason, that baby needs to go to the clinic, And a baby that's got a lot of congestion in the nose in the young age group, because it becomes a catastrophe. But if I have a 10-year-old with a blocked nose, it's okay. We can wait until we go to the pharmacy tomorrow. But if I've got a young baby with a blocked nose, that's a different story altogether. So the age groups are important.
Definitely. And I love, again, that there is that reference point. There is that kind of way to see as to whether or not my child at whichever age is doing what it's supposed to be doing. Now, in terms of nutrition, right, I think with the wealth of knowledge and technology, people hear a bunch of things. Okay, your child should maybe eat this many calories, and you should limit them because you don't want them to get fat, to get diabetes. Or what are your concepts around nutrition? What children should eat, what they shouldn't eat? Should you limit them? Should they eat whatever they need to eat because they are growing so quickly?
Remember, Fezile, I think good nutrition is for everyone. It's for me, it's for you, it's for the whole family. And children will emulate what we do as adults. So if I come home and I don't have supper, my daughter will question that. But mommy, you didn't have supper and I had my supper.
She'll pull you back.
Exactly.
Like, hey.
So we need to go back to the drawing board. We need to correct ourselves first before we try and just, correct these children, because they watch what we do and they copy what we do. So with the nutrition, children are different. You'll get a fussy child that doesn't want to eat anything, that only wants to drink milk. And then you'll get a child that wants to eat everything. And then you get a child that only wants to eat junk food. It's very difficult. I'm a mother as well, and I really do understand the stress that a child that isn't eating right, can cause to the whole family. It can cause a whole lot of discord. So what I always advise is that, first of all, please, we must not skip breakfast, especially in a school-going child. They would have had that fast throughout the night when they are sleeping, right, the blood glucose in the morning will drop a little bit. You need blood glucose, a normal level of blood glucose to feed the brain. So if my child skips breakfast, they are going to struggle during the day. You know, they need an active brain. They need to be alert, you know. So they do need to have breakfast. They must. If your child is a kind of child who doesn't like to eat much in the morning, at least let them have a smoothie, something that's packed with proteins, you know, or let them have a fruit, you know. So the rule for me is just don't allow your children to skip breakfast. And we ourselves as well, we must try to grab something in the morning. And then the lunch boxes are becoming more and more interesting, hey? So there's no excuse. There is absolutely no excuse. Like, you need to learn what your child likes. And with each meal, let them have 3 small meals, right? I don't want to say 3 big meals, 3 small meals. And then in between, they can snack with dairy or legumes. So what I mean with 3 small meals, they must have a carb, be it bread or maybe some sweet potato.
Sure.
And then they can have a veg with that. So, and then for lunch as well and supper, they must do that. And then in between, let them have their milk or their smoothie or their yogurt. And lots of water, hey?
Yeah,
Especially
it's
now
true.
in summer, it's been extremely humid, you know, and our children need to stay hydrated.
I think it's and especially the foods that you're talking about, the food groups with your carbs and those kind of breakdowns, you make sure that your energy level is relatively consistent, because I know the kids,
Yeah.
they need that. They need to be able to
Yes.
engage with the world, and if their
Yeah.
fuel isn't there, then they aren't going to be able to. And especially when it comes to sugar-based things, then you start to
Yes.
have that dysregulation with
Exactly.
regards to your energy, and that also gives children highs and lows, which aren't great for them, because those lows can really make them just feel like they don't want to go out and engage at all.
Exactly.
Yeah.
And they're not even active in the classroom. What I do like and what I've seen happening with the schools now is that they actually encourage children to come in with healthy lunch boxes. So no junk, and then maybe they'll have like one day or a Friday, they say, okay, bring a treat.
something, yeah.
That's realistic because they're still children, right?
Yeah,
So they need to
exactly.
have their cake and sweets, but not every day.
Exactly.
Yeah, we
And-
must have some boundaries. And they also say we must replace the juice with the water.
and water, and I tell this to parents all the time, I give them general advice, we need water.
Yeah.
Kids need it
Yeah.
a lot because they're running with the sun, with
Yes.
everything else. They don't know the signs of mild dehydration or the
Yeah.
fact that their body doesn't have enough water in
Yeah.
it. So it's important to make sure that they hydrate. But
Absolutely.
before we end this, because unfortunately when it comes to kids, we could probably go on just from the various different age groups.
Yeah.
I would like to just give people this connection of dots when it comes to what to expect with food. So you have your newborns who have the breastfeeding. When do they transition, and at which point are you giving food? Is it soft foods? What are some of the general concepts around how you transition from your colostrum to the breastfeeding, normal milk, to then softer foods, to solids, etc.?
Okay. I know I've been very repetitive about this. Again.
Repetition is good because that means that they have no excuse not to know.
Yeah. Roll to Health booklet.
There we go.
Page 1 and 2.
He even tells you where to go.
Okay, so I'll tell you what the concept. Okay, first of all, let's be realistic. Breastfeeding is the best.
Yeah.
Nothing can replace the goodness of breast milk. Okay. I know that formula, the brands, they tend to say their formula is the next best thing to breast milk. To be quite honest, it's not. But I'm not saying that formula is bad. I do know that there are parents who cannot breastfeed for many medical reasons and also for personal reasons as well. But we are lucky in the sense that we have formula available, so that's fine. Breast milk is the best, especially for a low birth weight child, for a preterm baby, and for any baby, in fact, for every baby.
Every baby.
Yeah, so many hospitals, they use the baby-friendly hospital initiative where they encourage breastfeeding early within the first hour of birth. Okay, So if for any reason a mom is unable to breastfeed, there's formula that's always available. And the situation is you have to exclusively breastfeed or formula feed or mix feed for 6 months with nothing else. So you don't need solids. I know it's hard to believe that or understand that concept for some of us because children really do feed a lot. They feed on demand, and it can be very tiring. It's a high demand for the parents. It's exhausting. They feed even at night. That's when people start thinking that the breast milk or the formula is not enough, and they put in a little bit of starch into the milk, which is not the best thing to do. Part of the reason why we say that breastfeeding and formula feeding is all your baby needs until they are about 6 months of age, it's all got to do with your digestive system, right? Your digestive system needs to grow, and you need to introduce things slowly. So milk is more than enough for your child for the first 6 months. When they are able to sit up, remember I talked about the milestones about sitting up, and at 6 months they start sitting up. Yeah. That means that the back is straight. That means that your food pipe is straight, and the chances of having reflux are now less. So your food pipe has grown nicely, your stomach has grown nicely, and we can now start introducing certain foods, solids into the diet. So the cutoff is 6 months. At 6 months, it's an absolute necessity for a child to start solids. So you can start by introducing one food type at a time. Maybe say, for example, want to start with potatoes. So you'll do potatoes that week and still continue with the breast milk or the formula. Then the following week, you're going to introduce potatoes with butternut, etc., like one food at a time. And if your baby has 3 teaspoons at any given time, good.
That's good.
Perfect. We don't want a baby finishing the whole bowl and then not having enough room for the milk. You still need the milk. And then the food groups, then you'll eventually introduce eggs, etc. But we can't stop giving them milk until they're about 2.5.
Okay.
Yeah, the milk still has to carry on. But what happens is after 6 months of life, the milk is no longer enough to sustain growth and maintain it. So that's why we then need to introduce solids. Yeah, so what parents find challenging is that sometimes children just don't like a certain food that the whole family likes. I think that's okay because we all have our own preferences. Just because my family likes avocado doesn't mean that I'm going to like it. You know what I mean? So you will learn, you kind of learn, and you see what your child prefers and what your child doesn't like. It's challenging. It's easy to talk about, but it's challenging in reality.
I always find that that's the case. And again, that's why it's great to have a reference point, but it's understanding the concepts and then making sure that you work around them that really helps.
Yeah.
Thank you so much for sitting down. It's Dr. Mommy. She knows what she's talking about. She has kids. She sees kids all the time. I hope you've been able to connect those dots, been able to understand children a little better. We definitely are going to need it to come in because just like kids grow, our knowledge needs to grow as well. But it's been another Medshield Movement Connect show episode with me, Dr. Fez. I'm going to see you on the next one and enjoy your kids, right?